Corneal crosslinking. What does a patient go through when they undergo crosslinking?
This is a treatment commonly done for patients with keratoconus. Well, the first step is going to be using a lid holder just to keep the eyelids open during the procedure, part of the procedure.
That way the patient doesn't have to worry about blinking. We do this first step at the slit lab. We don't have the patient back in the operating room lying down. Patient sitting up, the eyes obviously numbed with gel and drops, so this is odd, but usually not uncomfortable. Next step is applying a dilute alcohol solution to the surface, and even though I touch the surface of the eye, the patient usually doesn't feel it. They just feel something is going on, but it's not painful.
And it's important to remember this is just changing the very superficial surface portion of the cornea, the epithelium, and those are those little wrinkles that we're seeing where that epithelium is just starting to loosen.
And that's exactly it. It just loosens up the top layer, makes it easier to remove, and again to remind you, this is a regular Q-tip just soaked in a solution to get the epithelium to come off more easily. And you can see how it always peels off by itself. Then it is removed with this is called a foreign body spud that then just takes that surface layer and gets it off the patient's cornea.
And the whole goal, the reason for doing this is to try to remove that superficial epithelium and allow the actual medication that's going to be used to absorb into the deeper parts of the tissue, which is the target for what we want to strengthen in patients with keratoconus, with the cross-linking.
And doing all this procedure, this is from the outside. The patient again sits at the slit lamp. This is the view magnified. And to make sure that the area is large enough, this slit beam serves as a reference mark.
Is that about 9 millimeters in size?
8 millimeter, usually a little bit larger. The first step is then saturating the cornea with riboflavin. There's two kinds of riboflavin in the United States. One's with dextran, which is this very thick solution. You can see how it sits on the surface of the eye. Initially, you place a large amount, then every 2 minutes, one extra drop is applied. Patient leans back and closes the eyes in between.
So that's every 2 minutes for 10 minutes initially, is that right?
Our rule is 10 minutes because we found that the cornea saturates completely, and then we rinse with a balanced salt solution. The reason for the rinse is otherwise the dextran thins out the cornea more and more. It's a hypertonic solution, meaning it pulls out fluid from the cornea, making it thinner. Patients with keratoconus usually have a thin cornea to begin with.
And we can see with that last video with the blue filter how that cornea has absorbed that medication, that liquid.
You can see from front to back everything is yellow, and you saw where the epithelium was, it's not. So hence the epithelium off allows better absorption.
Lid holder being placed back into the eye now. This is to prepare the patient for the actual cross-linking, which is going to take about 30 minutes total of looking at the UV light and providing that actual cross-linking.
And this solution, as you could tell, is much thinner. It gets dropped on the surface of the eye. Here we make sure that the surface and the cornea is thick enough. It should be above 400 microns for safe application of the UV light. And this lid holder, as you can also see, application feels odd because there's some stretch on the lids, but after a few moments, especially with everything else going on, patient usually doesn't notice it is there.
And all of those red lines are to try to target and center the actual cross-linking UV light directly over the center of the eye. And this is what the screen looks like on the actual UV delivery device. And it starts at 30 minutes and starts to count down, and every 2 minutes, additional medication is being added.
And you probably saw patients twiddling their thumbs. They usually have nothing to do except look at a light and have drops in their eye. We use as much numbing drops as we need to keep the patients comfortable, and usually we also try to keep their minds off of the procedure by talking to them.
This is application of more of the medication. The only part of the procedure we're not going to see is at the very end to cover up the cornea. A bandage contact lens will be placed, and that cornea heals back completely after about a week.
Discomfort and pain usually for the first 4 days. The first day is the most uncomfortable, and then it gets less and less uncomfortable as time progresses. Most patients after 4 days have no more pain.
And the machine says right there, apply riboflavin, and that's every 2 minutes for the 30-minute time period during this portion here.
And this particular patient, with all this process, he was very concerned about this beforehand. We asked him later, do you have any pain to the procedure? He said no, some discomfort afterwards, but as predicted, it went away fairly quickly.